Hi, I'm Mrs. Coleman, and this is Dr. Bridget Melton. Today we are going to be doing the ACSM cycle ergometer test. So this is a lab-based test, meaning that you are going to have a Monarch cycle. This is a 939E. These are quite expensive, so unless you're working within a university, a separate research facility, or in a doctor's office, you're probably not going to have access to these. However, the benefit of these is that we can increase workload for proper intensity levels as her heart rate is increasing during the test. And we're not having to rely on her motivation to continue with the test in order for us to get an appropriate cardiorespiratory response. That cardiorespiratory response is going to be evaluated in this test via heart rate and blood pressure. One, to ensure that the intensity level is appropriate and to ensure that she's safe. So some other equipment we're going to have, you'll see she's got a blood pressure cuff on so that I can see the manometer during the test. I will be loosening it, deflating it when I'm not taking blood pressure. So you may see me take it on and off during the test. Bridget is also a very avid runner, so she has her own.
And it's
That's a
completely
compliment.
off. It's completely off. So we have 3 heart rate monitors going on here.
So her Garmin is not connected to the chest monitor. So she does have one under her shirt, and so it's with skin contact. She's had to wet it down, so we're getting proper connection there. Right now, her Polar heart rate monitor wristwatch is showing 70 beats per minute, while her Garmin is showing 23. So obviously, Bridget.
Calories.
73. So we're pretty even right now.
But
Sorry.
up there says 60. So
We don't know what's going on except that Bridget's alive.
Yeah.
Okay, so far so good. For setting up for the bike height, you want to bring the bike saddle up to about the point of the greater truncator. If you forget that, about hip level is also a good place to go. So once you have that set, make sure you have screwed in the seat post so the person doesn't get on and then fall through.
Smoking test. Do you want to give me a?
I'm going to get you there in just a second.
Okay.
We're going to see if you can handle being on the bike first. She wants to know if I'm going to ask her about smoking, if you're wondering what that comment was about. So then what we're making sure of here is that we have a 5 to 10 degree angle at the knee. So there should be a slight bend in the knee basically at the bottom of the pedal stroke, which we see right now with Bridget. Also during the test, Bridget, with the exception of when I go to take your blood pressure, you're going to keep your hands on the handlebars at all times. You shouldn't feel like you have to death grip either. You feel pretty relaxed, shoulders are down away from the ears. Okay, awesome. So in most cases, if Bridget was a new client coming in, I would have given her a Part2. If I was in a medical facility, she probably would have taken a health history questionnaire at this point in time for clearance. So I'm going to treat this as if Bridget has been my client. There's been no need to think otherwise that she wouldn't be able to go through with this test, but it's always good to check in with a client anyways. So Bridget, did you eat breakfast this morning?
Yes, ma'am.
Okay. Are you properly hydrated?
Yes.
How would I know if Bridget's properly hydrated? If you were really good rapport with the person, you could ask them about the color of their urine. If they look, so you're looking for like that nice light yellow color. Any recent injuries or changes to medication?
Nope.
Okay, so I'm getting with that too with concussion. I'm making sure if I knew of any medications that she hasn't changed them.
I've taken my medication.
She has taken her medication. I would know what that medication is if it does impact heart rate response, which is critical to increasing intensity in this test, which it's not. She didn't take any medication. Any recreational use, smoking, cigarettes, marijuana.
On record, no.
Not in the state of Georgia yet. However, that should be something that's on your radar, you guys, if you decide to go to grad school in Colorado, Washington, or California.
Even if they are a smoker, you just want to make sure they haven't had any nicotine within the last 30 minutes. If we do this in the morning, we tell them to refrain in the morning.
From coffee.
Yeah.
Good luck. But anyways.
I've had my coffee.
That's not a reason not to do the test.
At 6 a.m. We're good. We're good.
So, yeah, pre-workout will do some funky things to folks if they get on this test. So, any other reason that you can think of why you should not be doing this test for today?
Nope.
Okay, I'm going to be evaluating your heart rate response and blood pressure to make sure that you're good to clear with the stages as we move on. If at any point in time during the test you have difficulty breathing, start experiencing chest pain, or any impending sense of doom, then it is okay to stop the test. We'll put you in the cool down right away. So, totally up to you to continue on. Feel good to go?
Okay.
All right, so I'm gonna have Bridget put her hands on the handlebars. We're gonna start with a warm up. I'm gonna take this off and I'll put it back on you because that's gonna be uber annoying. So that didn't work out, that's okay. So we're gonna start with a warm up phase right now. So this is our Monarch system. We are going to start with a 0.5 kilogram, which means that we're gonna be at, I believe it is 25 watts to start. So I'm going to go ahead and hit start, and I'm going to increase the wattage here. I have my timer here, so we're 5 seconds in. What I'm looking for in this first 2 minutes is that if she's under 80 beats per minute for her heart rate, we're going to bump up to 2.5 kilograms, which is going to be 125 watts. And then there's 80 to 89, which would be 2, 90 to 100, 1.5, and greater than 101. If she's greater than 110 beats per minute for 2 consecutive stages, and then it ends. Well, you're also doing this, Bridget, I forgot to ask what your age is.